when it comes to the cuts and scrapes and every need of the child. So this is a very relatable project also for myself. And we've invited an ER med doctors, especially si Dr. Joy, who is also a mother herself. So we invited her here today because I think she's also the perfect person to talk about first aid training for the moms as well, as she has also the first-hand experience. So introducing to you Dr. Joy Santo Domingo. She is an emergency medicine physician, a pediatric life support provider, a basic life support provider, an advanced cardiopulmonary life support provider under the American Heart Association. She has taken her residency in Makati Medical Center and she is now one of the chair people of the emergency department in VRP. So I'm very excited for that she is here with us today to talk about first aid training for kids. So please join me in welcoming Dr. Joy Santo Domingo.
Hi girls, good morning. So my name is Dr. Joy and today we'll be talking about baby first aid. So I have with me here Dr. Dan Luchanko. So he's also an emergency medicine physician currently at Makati Medical Center, and we're also from a company called Early Intervention Management, and we do training and seminars on baby first aid. So let's begin. The first part of our course, we're starting a little bit late, will be the lecture series. It will be for about 1 hour, and then after that we're going to have hands-on training with CPR and choking. Okay? Let's start with a pop quiz. So, what do you think is the most common cause of death in children? Accidents. Good. Okay. Pneumonia. Wow, very good. So it depends on where you get your data. If you base it on the CDC, or Center for Disease Control and Prevention, they base their data on first world countries. So the most common cause of death for them is unintentional injury. Now when you take into consideration the third world countries, it's pneumonia. So infection is the top cause. So injuries are the leading cause of death in children above 1 year old. Accidents can happen anywhere, at home, in school, at the playground. The first few moments after an injury, the first few hours, are the most critical. The important thing to do is to stay calm, and if you know what you're doing, it will help prevent injury and minimize complications. So, early CPR saves lives. When you have children with severe illness or severe injuries, cardiac arrest can occur. So, pediatric life support is it's a measure for saving lives. And this is the chain of survival. Let's start moving backwards. So, the advanced healthcare system, the emergency response system, someone calls for the ambulance. While waiting for someone to call the ambulance, we start CPR, and this can all be prevented. Starts with prevention. So trust me, I'm an ER doctor. I did my residency, as Chrissy mentioned, in Makati Medical Center. Emergency medicine is a specialty. It is relatively new in the Philippines, but it's very big in Europe and in the United States. In the US, it's one of the hardest specialties to get into. We see in Makati Med about 350 patients per day. Maybe around 20% of these are children. And the parents always ask us, what could I have done to prevent this kind of injury? So frequently asked questions. What can I do as first aid? When should I bring my child to the ER? And what can I do to prevent injuries? Today, these are the following topics that we are going to cover. Cuts and wounds, burns and scalds, allergies, bites and stings, animal bites, dehydration, first aid kit, child and infant CPR, and child and infant choking. So cuts and wounds. So the way you manage a wound depends on how deep it is. Basically, there are 3 layers of the skin. The topmost layer, the superficial layer of the skin, followed by the fat, and then the muscle. In any case, any wound is a break in the skin, and it poses a risk for tetanus infection. So tetanus immunization is always important when you have a wound in the skin. However, if your children have the DPT vaccine, they're covered until they're about 7 years old. This is an example of an abrasion. So an abrasion is a wound that's caused when your skin hits a rough surface, a rough or a hard surface.